You are a nurse practitioner, so you specialize in providing healthy alternatives from a natural approach or a holistic approach. So just give our audience, give the audience just a 411 about the importance of gut health and what its purpose is all about.
Absolutely. First of all, just thank you for the opportunity to let people know that there's other things out there. I know there's a big hype about probiotics and kombuchas and all like that, but I think like anything else, people just kind of get misled into the social media without kind of knowing the facts. So today I just want to take a little bit of time to talk about gut biome or gut health from an integrative perspective, which is the kind of nurse practitioner that I do that combines both Western and integrative natural approaches to healing our body. So, you know, Hippocrates said it many years ago, light years ahead of his time, that all diseases originated in our gut, and he's exactly right. That's been proven time and time again. So I just want to start out today just by talking about what is gut microbiome. I mean, you hear it, all the scientific hype about it, but just kind of bring it down to just a layman's term. So basically, it's just all the bacteria, and it's a genetic disposition of a thumbprint, if you will, of the microbes that are in each one of our gut and colon. And that is unique for every individual, even for twins. So that's your thumbprint. And what that will help us do, it plays roles in many ways. So like one of the ways that the gut microbiome, it helps us to break down our food, so it contains enzymes. Another thing that it helps us to do is it raises our immunity. I'm going to go over just a few little facts that a lot of people may not know, but like 60% of your immunity is actually derived from your gut. So that's where we work on when someone has immunity or allergy issues. It helps us to make vitamins, precursors for that. The bacteria, we have lots of bacteria. They serve lots of good purposes in our gut, but sometimes when they get in an overload, like in SIBO, that's another big hype, which is just small intestinal bowel overgrowth. They grow where they're not supposed to, but it can lead to obesity. So a lot of people are wondering, I'm doing all the great exercises, I'm not eating anything, but yet I'm gaining weight or can't lose weight. Well, they did a blind study on two twins, which I found very interesting, and they had a thin build twin and an identical twin that was overweight. They took gut biome from each one of them and placed it into mice. And the one that was overweight also had diabetes and high blood pressure and a lot of other comorbidities. And then the one who was thinner was healthier, didn't have any health issues. And when they injected their gut biome into two mice that were perfectly healthy, within months, the larger twins mice blew up, gained weight, started having thyroid issues, developed diabetes. So we know that that plays a huge role in our diseases. So that's kind of from an integrative standpoint when you come to me. It doesn't matter if it's about a headache or a fungus on your toe, or it doesn't matter skin rash issues. We're always going to address your gut. So that's kind of where we start from the integrative standpoint. So when you're talking just about all the things that it can do, but some people want to know, well, how do I know if my gut is unhealthy? So I've kind of polled some things that I see in my clinic all the time before I do some DNA stool testing on them. But if you have high cravings for sugar or carbs, bloating or gas, diarrhea versus constipation or alternating, chronic fatigue is a really big one because we're not absorbing any of our nutrients. Weight gain or inability to gain. If you have autoimmune disorders, remember those diseases come from the gut. Food allergies, anxiety and depression, that is another one that people don't understand, that serotonin is actually derived from our gut, not from our brain. So I'll always call our brain mother, because, you know, at home, if mama's not happy, then nobody's going to be happy, right? So our gut's kind of the same way. If it's not happy and it can't absorb and it can't get rid of toxins, then our body is not going to be healthy. So again, that's where we start. Another tidbit that people may not know is the stomach is actually considered the second brain. And why? Because the brain and the gut talk all day long together. And if you've ever had to give a talk or a speech and something you've been nervous about, your brain's telling you you're anxious, and then what does it do? It sends a signal to your stomach and your bowels, and I think we know what happens after that. We get very nervous, and the stomach starts to get very upset too, so they talk all day long together. So that's why, again, we're just going to go back to the gut and start working on that gut. So the next question most people will ask me is, all right, well, I definitely have all those symptoms. What can I do to make my gut better? Do I need an antibiotic? Do I need, Western may tell you yes, but from an integrative, holistic standpoint, we really try to clear because we know that antibiotics wipe out our good bacteria. So these are just kind of some things that you could start to do just every day for everyone. Healthy eating, which means smaller meals and chewing our food, Ed. I think it's so simple, but yet we forget that that's where most of our digestion occurs, not in our stomach. And so when you're sitting here talking about digestion, by the time in our fast-paced world, we go chomp, chomp, swallow, right? And then the stomach's going, hey, mouth, you didn't do your job. And that's what ends up happening. So it's poor digestion, and then we have poor bowel habits, and then it leads to chronic fatigue, and on and on and on. So it's a vicious cycle. So water. A lot of people don't know you're not supposed to drink with your meal. You drink before your meal or after your meal, but not during your meal, or very minimal, less than 4 ounces during your meal, so we're not wiping out all our good enzymes and acid to help try to break that food down so it can do its job right. Making sure we're removing any allergies, any foods that are insulting to our body. Number one thing that I see is gluten. Probably about 80% of the population that we have, that it's an offender for them. So when you keep taking on an offender, you have to keep insulting the gut. So therefore, that creates more problems. So making sure you're removing any of your foods. In the integrative world, we will test you to see what are your biggest offenders, because I have people that eat avocado, and it's great, but their body can't take that in. So it's an insult, we call that. So making sure that a lot of good plant-based, high-fiber foods, organic for our dirty, we call them the dirty foods. That's those like grapes and things tomatoes that are exposed to glyphosate or pesticides. So you want to make sure that you're buying organic and cleaning your foods well. And then there's also the big hype on fermented foods. It's wonderful. A lot of people do not still know about that. And so the fermented foods like kombucha or kefir, sauerkraut, kimchi, all these wonderful things add just billions of natural live probiotics. And you can get them in your food instead of in supplement form, which is the best way to do that. And that just helps to grow a healthy bacteria in your gut. And then another thing is just probiotics and prebiotics, and a lot of people don't. I get questions about that all the time. Well, we got probiotics, we got prebiotics. I mean, I really am starting to feel like it's a psychobiotic world, because there's just so much social media out there, and you just never know which way to turn. So just know your facts. A prebiotic needs to be encapsulated with a good wrapping, so that when it reaches the stomach, it can bypass the stomach and not be broke down by the acid. That's not where we want our probiotics. We want them in our colon so they can start replicating. That's where that good bacteria live. So if you've got a probiotic, make sure that it can sustain that acid, get down into the colon so it can do its job. And its number one job is to feed our healthy bacteria. And then you've got probiotics, and they're actually considered live good bacteria. Again, feeding, repopulating the colon, especially after an antibiotic usage. You want to get a probiotic to make sure that you can repopulate it in a good way. So that's kind of it in a nutshell. Some of the things, though, that I tell people that this actually a poor gut health can be linked to is, a laundry list of problems, ranging from, as we talked a little bit earlier, autoimmune disorder. I see a lot of Hashimoto's or lupus and Crohn's and that sort of thing that comes from poor gut health. We see chronic fatigue from that as well, failure to thrive in children. We see anywhere from psoriasis from that autoimmune line, just literally from taking in foods and insults that once you eliminate that, it kind of overall helps your whole immunity. But there's just a ton of things from cardiac disease to thyroid disease to, there isn't one function in the body that poor gut health is not going to play a role in. So, again, you always ask yourself, why the gut? Well, when you list all the things that it does right and all the things that it can do wrong for us, my question is, why would we not be initiating the gut health first? So that's kind of it on the 411 for me about just good gut biome that we need to be working on, all of us.
Well, it's a lot of information that you put out there, Christine. It's great and it's vital. I want to ask you, just getting back to more about microbiomes in the gut health. Does environment make a difference? Because we know sometimes people may say, I guess that there's a myriad of reasons why people don't eat healthy. Sometimes people may say, oh, it was my environment or where I grew up, or some people may have grown around food deserts. You that grew up near food deserts, do you think that has something to do with gut health, or do you think it may be genetic, or as you mentioned earlier, do you think it has something to do with any type of autoimmune conditions?
Absolutely, Ed, head on. So our environment is crucial to our gut health. So, and we know this, again, by the facts, backing it up. When a child is born and they get that mother's breast milk, if for a mom that breastfeeds, they get the mother's gut biome. So not only, that's where that, again, our immunity, that's why that colostrum is vital for a newborn, because they don't have that immunity right starting out the gate. So they get a lot, well, they do have it, but they get so much more from the mother's colostrum in her breast milk because it's acquiring her immunity. So, environmentally, if you don't get breastfed or you don't get birthed vaginally, you lose a lot of that. Secondly, for our poor socioeconomic families, I was a child of that growing up, and I thought everyone ate blocked cheese because that's what we had. It was inexpensive. It could go a long ways, and now knowing what I know, oh my goodness, it plays a huge role because typically there's a lot of pesticides. They can't buy the organic line, so therefore they're exposed to a lot of extra chemicals by not being able to have the privilege to be able to financially afford the better foods or even have access, because the more culturally diverse you are with all your fruits and vegetables, that creates a healthier gut biome. But hey, my parents, when they separated, we didn't have very much. We ate beans several nights a week, and I didn't have a lot of diversity there. I had a lot of fiber, but not a lot of diversity. So that absolutely will play a role. Genetic certainly plays a role. However, this is what I tell my patients. You can pick the genes that you wear, but you can't pick the genes your parents gave you, right? However, those genes do not have to express if you change your lifestyle. So you don't want to give them the opportunity to express. So the younger we can start feeding into our children healthier diet choices and diversity, the better, one, as they get older, the better choices that they will have, but they're also creating such, in the long run, the longevity, a better gut biome, which will raise immunity. That's where all our allergies are coming from. Those allergies derive in that gut. So, right out the gate, these children are born with tons and tons of allergies. It's the exposures that their parents exhibited a lot of the times, not all the time, but a lot of the time. That's where they're getting it from, is their environment. Absolutely.
Let's stay with diet for a second. And you mentioned about improving your gut health, and you mentioned about eating more fiber and eating the dirty foods and doing all the things that's necessary to keep your gut healthy and prevent it from any type of autoimmune conditions or any type of serious illnesses. What's your take on vegetarian and vegan diets? Do you have a specific diet for your patients in terms of improving gut health, or are you pretty relaxed with your patients in terms of their dietary choices?
So, first of all, I never try to use the big nasty word diet, because that all immediately makes me feel like I'm being punished. I can't have something. So I just try to basically tell people, let's start identifying what's good for your body, because, again, it's a DNA thumbprint, right? So what's good for me isn't going to be good for Ed all the time. So we do identify those initially, what's insults and what's not. Secondly, we know across the board certain diseases, such as an autoimmune. So when we have an autoimmune that we've identified through our clinical assessment and blood work and what have you, then we remove all gluten from the diet, because we know that gluten is not the same good quality gluten that our granddaddy and great-granddaddies had. It's genetically modified. It no longer, it enters the body, and the body identifies it as some foreign chemical. So then it starts to attack our colon and our lining, causing what we know leaky gut syndrome, which is a real thing, where that lining becomes permeable and food starts to seep out, and then you've got inflammation and the whole shebang. So we do talk about healthy lifestyle eating, and I just tell people this is a lifestyle change. You need to make better choices. So we're going to eliminate sugar. That's first and foremost. You don't have to be a diabetic or non-diabetic. Sugar is not going to be good for anyone. Doesn't serve much good purposes. So we're going to eliminate or reduce that significantly. We're going to reduce gluten out of our diet. And then depending on whatever else you've got going on, we're going to tailor that lifestyle to better suit the need of that patient. So some people have genetic predispositions that don't absorb their B vitamins well. So, they're not getting that in their food, so we have to adjust it with supplements. So a lot of that's going to be tailored individually, but across the board, you don't want your dirty foods, which are like your grapes and those tomatoes and certain foods that are exposed to the chemical glyphosate pesticides. You want to make sure it's organic and rinsed well. You want to eat a diverse group of fruits and vegetables across the board. Everyone could benefit from that. So I know keto is a really big push. I've had several people come in with that, and they're gaining weight on it and not realizing, you don't have a gallbladder and you're not processing your food, your fats very well. So, again, that's more of an individual thing. So I don't really have, per se, one diet that I like. I like diverse, clean, just healthier eating, less animal protein, no gluten for most people. So across the board, that's kind of what I will target. But again, it's just kind of individualized.
Again, with more on gut health, you mentioned, Christine, about foods, and I also want to bring up supplementation for your patients or anyone that may have questions in terms of gut health. And again, you mentioned and you talked about the dietary habits, but what about supplementation? What type of supplements do you recommend for people wanting to restore their gut health?
So, Ed, that's a great question. A lot of people come to me with, U-hauls of supplements because, again, I think social media really sends out a lot of confusion out there, and all these different talk shows and people have their own take on it. So what I tell people is know your product, know it well. Over-the-counter ones, it's that old saying, you get what you pay for. Now, that doesn't always mean you need to pay $90 for a probiotic, right? Just research your product. Know where they're coming from. Know who makes it. Do they do research on their products? Do they support it? Is it Has anybody looked into it? Is there a third-party study looking at it? What's the quality of it? So I have a few that I like. I never try to narrow anyone down because, again, everyone is so uniquely made that I feel we got to make sure we have options. But I love standard process products. They're pure and their quality is amazing. They're really good about not putting in any fillers. Everything from there that I treat with is herbal or plant-based. So it eliminates all of those nasty side effects that you get with kind of prescription medications. A couple simple things. I always increase people's magnesium when they're constipated. It's more mag will help you to go. So, it's really simple. Instead of taking stool softeners and laxatives and all those harsh things, we just need more magnesium and more hydration. That pretty much will solve 80% of patient issues for me. It just about not let me down, and it's a nice alternative, natural. So some of the other things is Nature Sunshine. So from a gut health perspective, there's 3 companies, and depending on, I pretty much will do a DNA stool testing called a GI mapping. And that one is imperative. I do that just about on every patient of mine because, again, it starts in the gut for us. So I want to know what that gut is doing. So I can give you all the supplements in the world, but if you're not absorbing your nutrients well or your supplements, then it's not going to be effective. So this GI mapping test is your own DNA in your stool, so it takes the guessing game out. It looks at your parasites, your fungus, your fat absorption, your immunity, whether you are or are not having difficulty processing gluten. It looks at the bacteria, the protozoans, your good bacteria, your bad bacteria. It looks at a ton of things. So, but it looks at yours. So it's DNA, and so that's what we make your regimen off of. And from there, I will pick and choose and devise, after I've analyzed it, a report from either Nature Sunshine, Designs for Health, or Standard Process. Those are my 3 go-tos that I really love their products, have had amazing results from them. They're all natural and their products are pure. So those are kind of my favorites.
I want to ask you, Christine, what are some of the risk factors for poor gut health?
Oh, gosh, that is a laundry list, Ed. So right off the bat, chronic fatigue, that gets blamed for a lot. Autoimmune, probably number 1. That's the other area that it can result in. Cardiac disease, diabetes, and the reason for that is because when you have leaky gut syndrome or poor gut biome and you have all this bacteria and infection, it can lead to MS. And people don't understand that because your body is made whole and it functions together. So when you've got a squeaky wheel out there like your gut biome, you're having all this inflammation taking place. The body is always fighting. It's always fighting. So it lowers and drains our immune system. So that makes us immune compromised in a lot of ways we don't realize. It leads to a ton of allergies. So when someone comes in and says, I have had allergies most of my life, I've done the shots, it doesn't help, it's their gut that needs to be healed. I have people that have food intolerance. They have irritable bowel syndrome. That's one of my favorites because it's a poor gut. That's what it is. So you got to get in there and identify what's going on and then start repopulating it and clearing it and healing it with the right herbs and supplements to be able to bring balance and restoration back to that gut. So it literally has been linked to cardiac disease because of the heavy metal toxicities that we find in people, and that's because they don't clear it. Their pathways are not good, so they can't clear out the things that they were able to maybe when they were younger, but their bodies just become burdened. So it's just a chronic list. Is another big one. High blood pressure is another big one. Malnourished is a big one because we're not able to absorb our vitamins as we take them in. Even those of us who are trying to get healthy and eating organic, if your gut isn't healthy, it can't take in those nutrients. So it's kind of a waste. So it's literally, I don't think I can think of anything that a poor gut will not be linked to.
Now, what are the symptoms to watch out for people that may be experiencing poor gut health?
So that's that's something that I alluded to a little bit earlier. I ask people just a general list of questions related to their gut. So they may not realize being chronically fatigued. They always want to blame it on the poor thyroid, bless his heart. But, a lot of the times it is, but a lot of the times it's not. So chronic fatigue, because their immune is being drained. They're chronically sick. I catch a cold easily. I have a ton of allergies. But I ask people all the time, what is their diet like? Tell me, how's your energy level? Tell me how your bowels are moving. And a lot of people don't realize that the normal bowel movement a day, a good healthy number of bowel movements a day, is 2 to 4. And most people that come to me say, wow, Miss Christine, I barely have that a week. And that makes me cringe because I know what's going on when that's happening. All the toxins are building up. Think about it. I mean, that's one of our largest ways we get rid of waste products. So you can only imagine what that's going to do. So, making sure that I ask people, when you eat, do you ever have reflux or heartburn? That's called heartburn. Do you have belching or gas? Are you bloated after your meals? We call them food babies. Do you have to undo your pants after you eat? I had that when I was younger. Never knew. I thought everybody had to do that. And your stomach gets really big, and there's a certain bacteria that produces methane, and they're methane producers. And methane, some of us may know, is gas. That's their sole job in life, is just to produce gas. So this GI map that I told you about earlier, it will test for that type of bacteria. But people will say, my belly gets really big after meals, even when I drink water. Or constipation. I've had constipation as long as I can remember, and that's another symptom of a poor gut health. Or sometimes, not to be too down and dirty, but they tell me, my supplements will pass in my stool, or my food will come out in my stool, or it's slimy, or there's an alteration and it's slimy, or it floats on top, or it has a foul smell to it, or all these symptoms are just very poor gut health. So those are some of the areas that I kind of look into for people that immediately start raising a red flag. Or if you look, I look on your med list and you've been on a PPI forever, which is to treat your reflux. That's a huge risk factor, not to mention all the risk that's associated with that. That's the first thing I'll try to do in getting my patients completely off of these.
This is a sports show, so I know at your practice you treat people from all walks of life, and I want to just kind of test your knowledge a bit, just as far as with how gut health relates to athletic performance. Have you done any research on that, and if so, what's the correlation between the two?
Well, just simply speaking, we know that nutritionally, if we are not absorbing our nutrients, athletically, we're not going to perform in the manner that we need to be performing in. So that's what a lot of my athletes get in trouble with. One, they're burning more of their calories and they're burning their energy up, but they're having a hard time sustaining their regimens. And typically we'll see, because they're not absorbing their nutrients, is a huge factor. So their enzymes are low, their gut biome or their good bacteria are offset, so they're having some problems with that. So it definitely affects our ability to hydrate, because that's where most of our water is absorbed, is in that intestinal tract. So when you're trying to replenish from a 5K or a triathlon, I have my athletes coming in with just cramps, or right after they'll be really struggling for several days with that. And part of it is, I know you do proper training, you can drink all the water and all the pre-sports drinks, but if your colon cannot absorb it because it's not healthy, we're going to run into some problems. So from a malnutrition standpoint, a vitamin nutrition standpoint, a hydration standpoint, that all certainly is going to play a role in that. Also, typically people that have constipation, their bowels aren't moving. Then my athletes, in general, their bowels do move because they're usually eating healthier for their, their lifestyles, or they're working out more and they're drinking more. So all those things play a good role in a good, healthy gut biome, or at least your bowels to be moving more frequently, right? So I find that that's better, but in their gut, it also looks at how we break those food down and that sort of thing. So I know from a nutritional standpoint, it goes hand in hand. You can't be working out and maxing out your body without nourishing it and hydrating it. So those are going to go hand in hand no matter what sport you're doing. So, but you have to make certain. And a lot of people think, oh, I got to get the good fats in. I had a patient who was just a notorious triathlon runner. She did it all. Very clean eater, ate from the ground only, but kept having allergies. So that kind of interfered with her ability to train when she kind of got run down with all her allergies. So that's what she came to me for, and looked at her diet. It looked great. She was going to the bathroom several times a day, healthy, but again, allergies trigger gut. So I'm thinking, okay, well, we may be off, but let me test your food allergies. Well, she was eating on average of three avocados a day just for that good, healthy fat, right? You hear about that? That's great. Well, when I did a food allergy testing on her, her number one food that was insulting her body were avocados. So
wow.
She thought she was doing good, but yet that was draining her body. So, and then gluten was a huge thing. So we removed the gluten from her body. And after we did a GI map on her, as healthy as this young lady was, she had a lot of blood in her stool she didn't know. She had no enzymes breaking her food down. And she was insulting, had a lot of leaky gut and inflammation inside of there. And when you're young and healthy and doing all the right things, it's only going to sustain you so long, and eventually you're going to tip that threshold when you get a little bit older, like myself.
Okay, well, while we're on continuing to talking about athletes, do you have any special plans, or do you put anything special together in terms of treating your athletes, or do you basically treat them the same as you would your regular patients?
Oh, no. For my athletes, I also do IV therapies there. That's a great question. Thank you, Brad. For my athletes, a lot of people don't know that we do NAD therapy there, and I do have several that come in and get NAD, which it's a very long name, and I'm not going to, try to wow people by saying it and telling them, but basically it's just pure ATP, and that basically is pure energy. And the one thing that people that are training, people that are hitting that iron slinging and all of those heavy, heavy components to their body, they will come in and get a treatment of that. And basically what it does is it's pure ATP. So after they go through this, or before and after, sometimes they'll come and get it, their performance is enhanced unbelievably. And it's because it's repairing any damaged cells. It's nourishing every muscle. It's putting 100% of the energy back into those muscles, those cell groups, so that they can perform at its top level. Because even when you're in the best shape of your life, you're still kind of burning those cells out, hitting them hard. So we know to do a before and after hydration and those types of things, but the muscle itself has to have that downtime to recover, right? Or you're going to end up in rhabdomyolysis and breaking that muscle down. And if you've ever worked out too hard, those of you out there, you kind of know what I'm talking about. So then we treat with hydration. So we'll definitely do an NAD therapy for those guys, and their recovery is unbelievable, and their performance is just, I had a guy who did powerlifting that came in, and he came back and he just told me he was able to max out and do so much more, and he contributed to the diet protocol that we kind of tweaked a little bit for him. He came in and got IV hydration, so he increased and infused his cells so they were well hydrated, because you can drink all you want, but it will never be like an IV hydration, because that is 100% in the cells. When we drink, our cells can only take in about 4 ounces at a time, so you can only saturate those cells, but when you get it in the IV, it's immediate absorption, bypasses the stomach, and it goes right into the cell so that they can do a great job. So we do that, and one of my favorite all-time IV infusions is MAGs. So we do a lot of magnesium. Magnesium it has a multitude of medicinal purposes, but for my athletes, what it does is, one, if there's an injury, it will heal it and reduce the inflammation and pain. 2, it helps with muscles, so it helps to relax the muscles. So when you've had a really, really hard work and you're trying to get back on track quicker, they'll come in and get MAG and help to relax those muscles, and it relieves the soreness out of everybody that has been hitting it really hard. So that's my favorite. I get a lot of good responses from that. And I also do Apollo cold laser therapy for my athletes. So if you've worked or strained or sprained a little bit, or maybe kind of had some poor ergonomics, or really kind of bench press a little too much, and we kind of strained some of our areas, our shoulders, our knees, lower back, neck, I will do cold laser therapy on those areas to reduce that inflammation, help to heal the ligaments and muscles, and all it does is bring your own immunity all to that area, and it will help it to heal like 10,000 times faster. It's extraordinary how fast it can recover any damaged cells or abused muscles or tendon tears or anything, broken bones, any of that. It will help the body to heal it 10 times faster. So
wow.
Those are all great tricks of the trade that we offer for our athletic peeps.
Wow, that is a lot, Christine, right there. And, great job as always. And now tell the audience out there just a little bit more about what you do, the services that you offer.
Sure. So the name of our practice is Christine Palmer. I am a family nurse practitioner, integrative. Again, I treat high blood pressure, diabetes, everything any primary care doctor would, so some people don't quite understand that. But our goal is to always try to do it integratively and as healthy as possible, but I don't push that on anyone, Ed. You know, I kind of do like God says, you meet people where they're at in their life. So, you know, being overweight is really hard and challenging, and so you just got to meet people where they're at and maybe not overload them with diet and exercises and don't eat this and do this and not this. So I just kind of help to get them on track again and get them going again. So I use both Western and natural, but mostly natural treatments. We do use a lot of herbs and supplements initially to kind of bring restoration and the body back to a wholeness state, because I believe that God designed the body perfect, and if you give that body what it needs, it can heal itself, and I believe that. So my job, you know, is a vessel to try to figure out what's going on with your body and get more to root cause, not just a script, not just, oh, my elbow hurts. Well, here, my knees have been bothering me. I want to know, are you eating nightshade plants? Because that's probably a big culprit if you are. And we want to figure out what the root cause of it is. So that's kind of what my specialty is. I dive more into what is the body lacking, what is insulting the body, what is it trying to tell us that it needs so that we can bring holistic to it. And I do that, like I said, through herbs, supplementation. We do treat pain with the cold laser therapy and the IV MAG pushes. I also treat a lot of autoimmune disorders. I probably get sought out a lot for that, for Hashimoto's, Crohn's, lupus, fibromyalgia, those types of things. And so we treat that. We have an IV therapy infusion room at our clinic, and so we'll do immune therapies, Meyer cocktails, NAD therapies. We also do treat addictions there as well, very effectively. We have a massage therapist in our practice that practices out of there. So we like to use a lot of diverse treatment modalities from a healthier perspective. I'm not saying injections are bad. I'm not saying pain medicine is bad. I think it all serves the purpose. But for me and my role in someone's health, we're going to try to do some alternative ways to bring that body back to, healing itself. And our number, if you'd like to call, is 225-937-7710. Again, it's just Christine M. Palmer, nurse practitioner.
First of all, Christine, thank you so much for this vital information and just not only letting me know, but letting the audience know about gut health and just the importance of not just for athletes, but for everyday people as well. And then your advice has been very vital to all of us. You heard it from her. She's nurse practitioner Christine Palmer. She's not only doing some things on the Western side, but more importantly, she's providing an alternative and using integrative medicine to, as she said, helping you to get back on track and just make your health aligned and getting back on the road of life. Christine, thank you so much for being on the program.
Thank you so much for this opportunity, Ed. It was a blessing. Thank you so much. I appreciate it.
Hey everybody, thank you so much for tuning into the channel. Remember to click like, share, and subscribe, and thank you for watching.